Bismillah Rahman Rahim. Today we will have case quiz number 84. Case data: 73 years old female complaining of subacute onset of severe pain in her neck, shoulders, lower back and hips. These symptoms had worsened progressively over the period of 12 weeks. During the same period, the patient partially lost her appetite and lost around 1 kilogram in weight. This is associated with substantial stiffness in her shoulders and back, which caused her difficulty in turning over in bed. She had previously been well, with no history of smoking or alcohol intake. Examination: there is a moderate pallor with no evidence of lymphadenopathy or thyromegaly. Pulse was 90 beat per minute, which is within normal. Blood pressure 120/80 milligram mercury, normal. Faint systolic murmur at the apex suggesting of a flow murmur. Mild weakness in her shoulder girdle and mild resting tremors of her hands. No objective muscle tenderness noted. Intermittent nighttime pyrexia with sweating attacks. Regarding investigations: low hemoglobin level 9.5 gram per deciliter, high white BCs 13.3, high platelet 605 cells, high ESR 119 millimeter for the first hour, high CRP, shooting CRP and ESR, CRP around 200, 198, and ESR 119. However, test results for thyroid, renal, and hepatic functions were normal. Levels of serum corrected calcium and vitamin D3 were normal, and results of urine diagnostic test were normal. Serum ferritin, vitamin B12, and red cell folate, blood culture, CBK, all were normal, and radiographs of the pelvis, chest, and abdominal ultrasound and EMG all were within normal results. So, what is the diagnosis? The answer is yes, it is easy today. This is an easy and straightforward case. It is polymyalgia rheumatica, PMR, polymyalgia rheumatica. Discussion of the diagnosis. PMR is a clinical syndrome of unknown etiology that is characterized by severe aching and stiffness in the neck, shoulder girdle, and pelvic girdle. It is often associated with moderate normochromic normocytic anemia. The prevalence is estimated to be 1 in every 200 people aged 50 years or older. White people are affected more than other ethnic groups, and females are affected twice as often as males. The patient was initially diagnosed with PMR because she not only fulfilled the criteria of Baird and Jones and Hazelman for the diagnosis of PMR, but also because diseases with similar presenting features to PMR were excluded by appropriate clinical, serological, biochemical, and radiological investigations. It was interesting to note, however, that the patient had markedly low hemoglobin level, which is uncommon in patients with PMR. The patient of PMR usually, if even, have mild normochromic normocytic anemia, but not marked anemia as this. So follow-up of the same case will be continued in the next case quiz. So This case is to be continued next week. And this is the first time for us to divide the case into two cases because it is interesting case. And finally, thank you very much for your attendance, and we will meet you tomorrow with the continuation of case quiz number 84 under the number case quiz 85. Wassalamu alaikum wa rahmatullahi wa barakatuh.